This is the Mohave County Board of Health meeting. We're called to order now. Let's see. First, we'll stand for Pledge of Allegiance.
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, roll call. Frank Labarge.
Present.
Larry Carver.
Here.
Dr. Hendricks.
Here.
Kathleen Bruck.
Here.
Terry Williams.
Here.
Dr. Wynn.
Here.
And Donna Williamson, Maggie Wilcox, Margaret Nyberg, and Joy Brotherton are absent.
Okay, I believe everyone received a copy of the minutes from October 16th. Are there any amendments to the minutes?
I move we accept the minutes as read.
Second.
All in favor? Aye. The minutes are approved. Let's see. Now we have a new item on the agenda, and that is the disease update from the Board of Health.
Good evening. I'm Christy Bronston, I'm the Nursing Services Manager. Patty had asked me to provide a communicable disease summary for you and to kind of give a snapshot of the investigations that we've worked on recently. We talked a little bit about that, I think, last time we met. First, to give a little bit of a background on the disease investigation process here in Mohave County and across Arizona. The Arizona Administrative Code, Title 9 and Chapter 6, which is our communicable disease and infestation codes, provides a list of 88 communicable diseases and conditions that are reportable to the local health department, as well as a list of those who should report those conditions to the health department. The list includes healthcare providers, healthcare institutions, correctional facilities, schools and child care establishments, shelters, and clinical laboratories. Pharmacies are also listed on that in that list, but they are obligated to report a list of medications that are associated with treating TB specifically. So the way that this works here, when a report comes into the health department, our public health team works with the providers to obtain all of the relevant information, clinical information specifically. We interview the individual client and the family to identify, potential source of infection, as well as those who may have been exposed in contact with the patient, and those that may need prophylactic medications. We determine the most appropriate interventions and the disease control strategies, and then implement them according to the CDC guidelines. So our public health team consists of public health nurses who gather information again from the providers, and we do the investigation and we implement the control measures throughout the community as needed. Our epidemiologist who analyzes the data from these investigations, and she helps us paint a picture or a map of what the disease is doing in the community, and helps us to determine which interventions are really going to be the most appropriate and most effective. Our team also consists of our environmental health department, who oftentimes are the first ones to receive the complaints from the community for a foodborne illness. Most of the time it's after they've eaten at a restaurant and they become ill and they want to file a complaint with the health department because, I'm sick and somebody needs to do something about it. But they will report that to our public health nursing, and we will follow up with the patient and get the relevant medical information. Then we work together as a team to identify if that is truly a public health concern or risk. So that's kind of how our disease control program works here in Mohave County. So since we haven't covered our communicable disease in a while, we thought that it would be appropriate to provide a couple of different reports for you. I think you have both of these handouts. One of them is a 2013 disease report. Now, this reflects only the confirmed cases that here in Mohave County, not the numerous reports and the investigations that we've actually followed up on. Now, if you notice on that list, it does not reflect all 88 diseases. It's quite short, much shorter than 88. These are the ones that are the most common here in Mohave County, and that's the way that our epidemiologist has been tracking. It didn't make sense to have a whole list of diseases that we had 0 cases of for a time. The other report that you have is new. It's a new report that she's been able to pull together. It represents this last quarter, so October through December. And that shows just the actual number of confirmed cases that have been reported. So this is a pretty straightforward on our disease report. I just wanted to highlight a couple of these. First of all, if you want to look at the pertussis, if you'll notice our pertussis in the 2013 report, or the annual report, you'll notice that there are 644 cases of pertussis. That was just from January to December of last year. We have had an ongoing pertussis outbreak up in our very northern communities, up in Colorado City and surrounding areas. Since the outbreak actually started in January of 2012. As of last Friday, the cumulative number of cases in that area has been 746 cases, with 36 of them still pending classification. There have been 11 hospitalizations, and we've been very fortunate there has been no deaths up to this point. We've implemented multiple public health strategies in both Mohave County Department of Public Health as well as Arizona Department of Health Services. We have had enhanced immunization campaigns that have included free vaccines. We normally have free vaccines for children, but also for adults as well, trying to get some of the adults covered. We have provided educational sessions for providers, for community members, and we've held specific sessions for parents to talk about immunizing their children. We provided fact sheets on pertussis that went to every household in Colorado City and their surrounding communities through their postal service, through utility companies, through schools, healthcare providers, and other community agencies. So, as of last week, we are definitely seeing a decline in the frequency of cases that are reported. We are now seeing about 1 case every 1.5 to 2 weeks, which is definitely an improvement. For a while, we were seeing well over 20 a week, and so we're seeing an improvement. One thing to note, though, your report, your annual report that you have in front of you, does not reflect some pertussis activity that is currently happening here in our lower Mohave County communities. Just since January this year, we have had 10 pertussis cases reported. We have 7 in Kingman, 2 in Lake Havasu City, and 1 in Bullhead City. These are ongoing investigations right now. There has been 1 lab confirmed, and the others are classified by clinical symptoms only. That number that is reflected on your annual report for pertussis, that does include our lower Mohave County. It's all of Mohave County numbers. So it does not represent only the Colorado City number. It's all of Mohave County. One thing to note with these latest cases that have been reported is there are 2 children, school-age children, that attend elementary school. So we're busy investigating those and trying to make sure that the children who are in school that are under-vaccinated or unvaccinated we address them and make sure that they are out of school or at least have if there's been contact. We're still investigating to see, what kind of risk they are in. Other interesting investigations that are not included on your report that we've been following up on just this last quarter is we've had a botulism case. This is not related to...
Excuse me?
Yes.
I'm sorry for interrupting, but I have a question. The 626 cases that you've got, are all of those confirmed by PCR and/or culture, or are they?
Are you referring to the 644 that's listed on the report?
Oh, I'm sorry. I was looking up at influenza 644. Yes.
Okay, so those are they are confirmed cases. So they can be either lab PCR, lab confirmed, or epidemiologically linked to a case. So according to CDC's case definition, they meet a confirmed case. Did I answer your question?
Yeah, you answered it, that they aren't all PCR or culture confirmed, but they are confirmed by another definition that the CDC
Has established.
approves.
Yes. And those are the guidelines we have to use.
Right.
Okay. Yes.
Okay, on your campaign for immunization up in the Colorado City area, are you tracking compliance as far as people, some way of measuring if people are getting vaccinated, or is it that impossible?
We have an office up in the Colorado City area, a part-time nurse that provides immunizations every week. And she has continued to have more, clients come in or families come in for vaccination. We've changed our strategy a little bit to work with the community. Sometimes it's very difficult for them to get into the office, and so she's made other arrangements for them. As far as a specific tracking mechanism to see how many families, we can tell you how many kids have come in to be vaccinated and how many vaccines we've provided, but we don't have a number to reflect what that number truly is in that community as far as the vaccine rates. And I think we've talked a little bit about previously about an immunization school assessment that we were conducting. And we have been able to get up into all of their public school and their charter schools to see what their vaccination rates, hoping to get some of that information that we can kind of wrap our hands around. We've done that through all schools in Mohave County. So I think that may provide us some of that detail that we're looking for. Any other questions? Okay. All right, so our botulism case, it's interesting to us. We don't have a whole lot of botulism cases that get reported. This one was unrelated to a food product. It was most likely a wound botulism. So unfortunately, it was identified too late for treatment, so we were unable to facilitate that, but that was one of the cases that took quite a bit of time for us to investigate. Another one was a malaria case. We've had outside our U.S. a traveler, and he had significant mosquito exposure, some history. So that was an interesting case. In addition to these, we've had a death in an unvaccinated child from related to Haemophilus influenza B, which is a vaccine-preventable disease. And there was also a death in a resident of one of our neighboring states from bacterial meningitis. We were involved primarily because this case was seen in our local hospital, and we had to follow up with contacts. So we had considerable amount of time investigating those contacts and following up with treatment. So that's the summary of our communicable disease activities for this last quarter. Any questions?
I have one other. What are you seeing in flu cases as far as, are you seeing a spike? Like I noticed in New Mexico that they're really spiking with flu right now, so.
This is the time of the year when we typically will see our influenza cases increase. We have heard from all of our hospitals that they are seeing increased numbers of influenza, and our surveillance system also indicates that. We have a few hospitals and urgent cares that participate in our influenza surveillance, which they'll take swabs. We pick them up, we send them to the state health department for testing, and that number has definitely increased. So it is definitely here. Influenza is circulating. Right now, it is, they're typing out the type of flu that is included in the vaccines.
Okay, thank you.
Now, that was my question. Well, was it the type of flu that was included in the vaccine? And does that reflect, that's another vaccination program. Is it being as successful as it was in past years? Is it?
Our influenza vaccine?
Yeah, the vaccine program.
You know, it's hard to say because we don't track influenza cases individually.
Yeah.
You know, our surveillance system really, the purpose of it is to identify the type of flu that is circulating. So we don't have solid numbers. And in many of the flu cases, never see a provider. And that's who initiates the reports back to the health department as our medical, community. So if they're not seen in the doctor's office, a lot of people don't go in for the flu. And so it's really difficult to say. Most of our indicators in the community are our community partners, so our hospitals. They've seen so much. We've heard from many of them that they are implementing their mask precautions from visitors, restricting visitors at sometimes. And we've also heard that there are some that are restricting or having employees wear their masks if they've chosen not to receive the flu vaccine. So it's here. It's well established, and this is about the time of the year that it does peak in January here in Mohave County.
Thank you.
Sure.
Is there any further discussion of this report? Okay. Thank you again for your report. Let's see. Now I got to find my. The next item is the proposed changes to the 2014 food code. That's Rachel Patterson.
Okay. Good evening. I'm Rachel Patterson, Environmental Health Manager. We've talked a little bit about the food code in past meetings, and we've been promising an update on what's going on in January, so here I am. Let's start with a little bit of background. We're going to talk about the FDA Model Food Code because that's the food code that we would like to adopt here in Mohave County. So I just want to give a little background on the food code itself. The food code provides best practices for food safety, and it also provides a uniform standard for the food industry as well as for the regulators, so that everyone's on the same page. It's updated every 4 years by the FDA. What's interesting and rather unique about the FDA Model Food Code is that the Conference for Food Protection is extremely involved in this process. They are a group that was founded in 1971. They meet about every 2 years to provide a forum for not just regulators, but for the food industry, for academia, for innovators, for consumer advocacy groups, and other consumer groups, to all meet and discuss changes that should be made to the food code. Those changes are proposed to the different councils. They divide up into several different councils, and they're all discussed, and then recommendations are made to FDA. And the FDA actually relies very heavily on this nonprofit organization for input. So, and one of the things that they absolutely are insistent about is that any changes that are made are based on good, sound science, good, principles. And so It's actually a very good system that FDA and the Conference for Food Protection has in place, working together that way. The Conference for Food Protection has also been instrumental in setting up, and this is just kind of a sidebar, the FDA program standards. Achieving national uniformity in the regulated community and among the regulators of the food industry has been subject of debate for years. Especially when you look at, for example, large chain restaurants who might have 500 locations spread out across the nation. They want to know that the requirements in one place are going to be the same as they are in the other place, or not much different, because it makes it easier for them to comply. And so that's kind of been the push with the program standards. It's a voluntary program. Jurisdictions can sign up as they are able. We are signed up for this. And it just gives us a chance to look at our program against the nation and make sure that what we're doing or what we're working for in our program meets national standards. One of those standards, Standard 1, is the food code. And the reason is because they would like to see the same food code being used across the nation. It just makes it easier on the food industry. The food code applies to retail food establishments. Those might include grocery stores, restaurants, mobile food units that I'm sure you see around every so often here in Mohave County. Temporary events, this would be a temporary food vendor at maybe the county fair, school cafeterias, and many more of those types of establishments. There are some exemptions that are written into the food code where they wouldn't have to comply with the food code, but they might have to comply with certain requirements. There are also some exemptions written into Arizona state statute. And those are for bake sales for charitable purposes, and there are some requirements surrounding that. Produce stands, if they're just selling whole, uncut produce, home-baked goods and confectionery goods law, that's actually a state or local statute exemption, and that's new in the last couple of years. There's an exemption now, this just changed in the last legislative session, for stores that only sell commercially prepackaged goods, like you would see at Staples when you go in there and all they have are chips and candy bars and sodas. They would not have to be on a permit with us. And there is actually an exemption for in-home cooking schools. There are specific requirements for that, though, like they can't be larger than 15 people, et cetera. But there are some exemptions to the food code for compliance. A little bit of history in Arizona. The Arizona Department of Health Services adopted the 2000. The Arizona Food Code was adopted in 2000, and it's based on the 1999 FDA Model Food Code. Last time I talked to you, there have been 3 revisions since then. And now there have been 4. The most recent revision came out in November 2013. I haven't had a chance to go through the entire thing. So far, I haven't seen anything really significant, but we have had 4 revisions. And while there are some new requirements for food establishments, if you're comparing the 99 FDA Model Food Code and the 2009 FDA Model Food Code, which is the one that we would like to adopt here, there are also quite a few provisions that are less restrictive for operators and that would benefit them in their food establishments. So as we go, I'm going to go through a few of the changes. I'm not going to go through every single change with you. I did put a summary of significant changes with your packets up there. I'm going to hit on most of those, but not all of them. If you see something there that you want me to discuss, I'm happy to discuss it. Or if you want to call me or email me or meet with me, I'm more than happy to meet with any of you at any time. So the way that this is organized is it's organized, the sheet that you have in front of you are the significant changes. This means that it's a change between the 99 and 2009 codes that would actually affect the operations in the kitchen. The insignificant changes I did not include on that summary sheet because there are a lot of wording changes. It doesn't affect the operations of the kitchen. For example, they changed the term counter-mounted equipment to table-mounted equipment. I mean, no one needs to know that. So those are what I would consider insignificant, or they might have clarified the difference between an egg and an egg product. It's not going to change the operations of the establishment. It's just a change that they made to be more consistent maybe, or it might have been based on new scientific terms or something. So like I said, as we go through, I'm only going to talk about significant changes, and I tried to narrow it down to the ones that would affect most of the establishments here in Mohave County. And I've classified them as more restrictive and less restrictive. You'll notice on that summary sheet, the first side is the more restrictive changes, and the other side are the changes that would be less restrictive on the operators. There is a comprehensive list of all of the changes available on our website under the Environmental Health Division, if anyone wants to look at that. I'm also going to highlight 2 changes that I believe could cause some fiscal impact to the operators. We want to be upfront about that, and so when we get there, I'll talk to you about that. So we're going to go over some of the more restrictive changes that they've made. One of the more significant changes they made in the definitions was the definition of potentially hazardous food. They have added cut leafy greens and tomatoes to the list of foods that are considered potentially hazardous. And that's mainly due to the increase in outbreaks that we've seen in the last 10 to 15 years that have to do with cut leafy greens, spinach, tomatoes. So it was due to that. And what this means, potentially hazardous food, that means that it's food that has to be kept basically under temperature control, which when we brought this up in the workshops. We did some workshops in October that I'll talk a little bit about later. Most people weren't very concerned with this because they keep their cut leafy greens and tomatoes in refrigeration anyway, mainly for quality reasons, so they last longer. So that didn't seem to be a huge concern in the workshop.
I have a question.
Yes.
They say cut leafy greens and tomatoes. Now, do they mean whole tomatoes or do they mean cut tomatoes?
Cut tomatoes.
Cut tomatoes, got it.
Yeah. Reduced oxygen packaging, this is when an establishment will package a food and take the air out of it. A simple example would be maybe a Ziploc bag, you know, how you pull the air out of it, you're reducing the oxygen in that packaging. Some establishments will do this, and they might want to can goods, or they might want to take the air out of it and save it for later to cook. And one of the microorganisms that they're extremely concerned about is botulism, of course, and that's been on the radar for a long time. But they did add Listeria monocytogenes as a microorganism to be controlled in this process as well. While it's not maybe as popular a microorganism, so to speak, as like Salmonella or E. coli, you don't hear as much about it. It does have a high death rate. It can cause miscarriage in pregnant women, and so they felt like this would be something based on good science that they should add to the definition, and that it should be controlled. And then it also includes some newer processes that some of the restaurants are using, cook chill, which is when they cook product part way and then they put it in a plastic bag and they seal it, put it away for later, and then bring it back out. And the sous vide process, that's when they actually cook food in a bag, in a tub of water, and it's a more even cook, and it keeps the juices in the meats and stuff. So anyway, they added that to the definition of reduced oxygen packaging. And that was just based on what we're seeing in the food industry more and more. The person in charge now would need to have knowledge of the major food allergens, and their employees would need to be trained in this. This is something that would be covered in the food manager's class with the person in charge, and we would change our food handler class to also add to that and add that to our training, so that they would be trained by the time that they got to the establishment. The person in charge would just need to make sure that they continued that training and that awareness and elevating the awareness of the food allergies. They need to be knowledgeable of the responsibilities if employees call in sick or report illness. And they added norovirus as a reportable disease by employees to the person in charge. And that was in addition to 4 other diseases that are reportable to the person in charge. The requirements for unpasteurized eggs have changed to be consistent with the Code of Federal Regulations. This won't apply to too many of our establishments because they don't package eggs, but In the food code, if you do package eggs, for whatever reason, you need to put safe, and they're unpasteurized, you need to have safe handling instructions on the carton for those eggs. And they also require the eggs to be brought in at 45 degrees or less. Ground meat that is undercooked cannot be offered for sale on a child's menu. This would only apply to those restaurants that actually have a child's menu. They just can't offer undercooked ground meat on that menu. That doesn't mean that the parent can't order it for them, but it can't be offered for sale on the menu itself. Mechanically tenderized meats now need to be cooked to an internal temperature of 155. I don't think that this was ever addressed before. 155 degrees is the minimum temperature for ground meats. 145 degrees is the minimum cooking temperature for steaks. The idea is that with a whole muscle intact beef steak, the contamination is on the outside and the inside is still sterile. Once you grind that up or you tenderize it, you're introducing bacteria to the rest of, into the internal parts of the meat. So they have clarified that if it's tenderized, it needs to be cooked to 155 degrees in the internal. That's the minimum internal temperature. If an establishment wants to do custom processing of animals for personal use in addition to their normal activities, this is not meat that would be offered for sale, but maybe they would be processing it for a hunter who just came back from his hunt and wants his deer or his elk processed. They can do that. They just need to let us know that they're doing it and get a variance from us. We just review their process for that, how they're going to keep it separate and make sure there's no cross-contamination and all those issues, and then we would approve them to do that. I don't believe that was addressed in previous food codes. If an establishment wanted to grow their own sprouts, and we do have a couple here in Mohave County, there's now a process for doing that, and which is good. And actually one of those people, at least one of them, came to one of our workshops and was very excited about this because he wants to start growing his own sprouts. I don't know if he owns a deli or a restaurant, but that isn't allowed, that would be allowed under this new food code. They would need to get a variance from us, which just means, again, that we would just review their process, and they would need to have a HACCP plan, which is a plan where they look at all of the critical control points throughout the process, and we just make sure that hazards are being avoided in that process. It adds if an establishment wants to package foods that have products in them that might cause an allergy, they have to label those products with whatever allergen is contained in that food. And they changed this in the food code to be consistent with the Food Allergen Labeling and Consumer Protection Act. So basically what that means is if they're packaging cakes and it happens to have soy in it, then they would put contains soy on the label. It also specifies that food cannot be reserved to clients or patients that are in a protective environment. So if you have patients in isolation or quarantine, that you couldn't reserve food from one person to the next. I guess that was never really clarified. But one thing it does is it also includes packaged foods, because you don't want any kind of contamination between one patient and another, especially if they're in isolation. It adds a requirement for those establishments that cook food that are in thin masses. It adds a requirement for a small diameter probe so that they can get an accurate measure of the internal temperature of that food. I have one up here, and you probably won't be able to see it, but it's a very, very small diameter that you can stick into maybe a very thin hamburger, for instance. Like McDonald's hamburgers tend to be extremely thin, and putting a normal size probe in there, you're not going to get a good temperature, so you would need something that's smaller like this. So it would only apply to those establishments that have thin masses of food that they cook. This is one that we purchased, and I think you can get these, I think they're between I saw them online for between $20 and $35, depending on who you buy them from. So this is something that could cause a fiscal impact, and this is one thing I wanted to point out to you. There's one more coming up. I think it's the next slide. Right. It includes requirements related to backflow prevention on carbonation devices. Basically, they want to see a backflow prevention or backflow preventer at the juncture between the water distribution system and the carbonation device. And they want to see it if you have copper piping, especially, because if carbon dioxide gets back into the copper piping, the copper can leach out into the water and cause copper poisoning on the other end. So they're trying to prevent copper poisoning. Most of the beverage companies, I believe, would have already installed this, and I don't think it will apply to too many people. But they may have to take care of this, and I don't know what kind of fiscal impact that would cause. I've looked up these backflow preventers, and I've seen them from anywhere from $50 to $75, somewhere in there. You can get a pretty good one. But the beverage companies should be following the model vending machine codes, and hopefully this is already in place for most people. And then lastly, it clarifies that establishments need to be free of pests. The current code says that they need to be minimized or just controlled to minimize their presence. We've always taken the stance that that means it needs to be free of pests. I mean, if we see roaches, mice, rats, ants, flies in an establishment, we are going to say something about it and work with the owners to get that problem taken care of. So the 2009 Food Code does clarify that the establishments cannot have any, and they shouldn't have any kind of infestation. So those are the highlights of the more restrictive regulations in the 2009 Food Code. Like I said, there's a few more there. If you have any questions on them, I'm happy to answer. So I want to highlight a few of the ones that are less restrictive. Again, under potentially hazardous food, the food that needs to be controlled for time and temperature, they've excluded eggs that have been pasteurized from this definition. So if the eggs have been pasteurized, they don't need to be under temperature control. And they've also changed the potentially hazardous food term to food that is time temperature control for safety. So it's just a little easier to understand. Potentially hazardous food, a lot of people don't know what that means. But when you say time and temperature control for safety, you kind of get more of an idea. So they've changed that. They added an exception for bare hand contact with ready-to-eat foods. When I first saw this, I thought, what are they doing? But what they're talking about here is if they're, because fruits and vegetables are considered ready to eat, you don't have to cook them in order to eat them, most of them. And if they wanted to wash an apple, for instance, they would have to put a glove on to wash the apple. So they've added an exception so that they can wash their produce without having to put gloves on. Employees only have to report disease exposure to the person in charge if they've been exposed within specified timeframes that are outlined in the food code. Right now, it's just open-ended. Have you ever been exposed to E. coli or salmonella or hepatitis A? And now the food code actually outlines if you've been exposed within 48 hours to norovirus, then you must report to your person in charge. If you've been exposed to salmonella within the last 14 days, then you have to report to your person in charge. So it's kind of narrowed that down a little bit. And they have to have actual knowledge of the exposure. There is a provision in the current food code that says that if they've been exposed to someone in their household, that they have to report it to the person in charge. Well, a dormitory could be considered a household, and you might not know everything that's going on in a dormitory. So they've added this provision that just says they have to have knowledge of the exposure. There have been some changes, a lot of changes actually, and I tried to summarize them for those who serve or sell shellfish. So we're talking about oysters, clams, mussels. They've lightened up the restrictions on storage, and they've been extremely rigid about not commingling shellfish and not taking them out of their original containers, and now there's some leeway for doing things like that. And they've also lessened the retention time for keeping the shell stock tags. Shellfish, when it's harvested, is not tested right away. It's tested after it's been shipped out. So the restaurant owners and the grocery stores are required to keep those tags in case there's a recall, if they find something wrong with those shellfish. So they were required to keep them for 90 days from the date of sale. Now they're only required to keep them 90 days from the harvest date. So that's actually less than the retention time, and I think a little bit less stress for the people who have to retain those records. This one lessens requirements for storing frozen meats. If the meat has been commercially processed and packaged, there are no requirements for how it has to be stored in a freezer as long as it's frozen. Right now, you have the, how do they do it? Swim, walk, fly. You know, you store the fish on top, or maybe the ready-to-eat stuff on top, and then you store the swimmers, and then you store the walkers, and then you store the flyers on the bottom, and chicken. So what they've done is, as long as it's frozen and it's been commercially packaged, there are no restrictions on how they store their meat and fish in their freezer. And so that'll help, especially with the really small restaurants that don't have a lot of room or a lot of space. It'll lower the hot holding temperature from 140 to 135. Once food is cooked to minimum temperature, a minimum internal temperature, then they want to hold it hot. Right now, they have to hold it at 140 degrees. That'll lower to 135 with this new food code. It does give an exception for hot holding of roasts because people are very particular about their roasts and they don't want them dry. So they allow them to hold the roast at 130. And this was a big one. They added a provision for keeping food out of refrigeration for a longer period of time. Right now, if they take food out of refrigeration at 41 degrees or below, they only have 4 hours. Yes?
This might be a stupid question, but when you're at the, at a mental block.
Buffet?
Buffet, thank you.
Oh, yeah.
Don't go to buffets much, although it looks like I do. When you go to the buffet and at the end of the buffet, there is a assistant chef cutting a roast into smaller pieces. Is that
Yes.
temperature at greater than 130?
It's supposed to be, right now, I believe the temperature has to be kept at over 140. With this, it would lower it to 130. But yeah, they would have to keep that at the proper temperature. And we do check that. I mean, if we see it, you know, we'll do it and we'll take a temperature of it
How?
with a probe
Oh,
thermometer.
no, I understand how you
Oh.
do it. That's fine. No, how can they keep it to that temperature? I don't understand that.
Yeah,
The heating element light?
the
that-
heating element.
That actually
yeah.
keeps them that hot?
It does, but this next provision that I'm going to talk about also gives them a little more leeway on it. If they know when they've taken that, because it's food that's time temperature controlled for safety, so that they know that they took it out at a certain time, they have a certain number of hours before they would have to toss it. And that's one of this provision. Once you take food out and it's at ambient temperature, you have 4 hours. This would increase it to 6. As long as, for cold food, as long as it didn't go over 70 degrees. But yeah, the hot food, we prefer that they keep it at 140 or above right now. And if they're not keeping it that way, then they have to figure out a different system. And a lot of times we'll suggest that they cut it into smaller pieces and maybe keep some in the back, you know, under a warmer or in an oven, and then they can do the small pieces and bring them out a little bit at a time. Restaurants like to make a big show, so they bring everything out, and especially at buffets. I mean, they'll pile the food up over, you know, the top of the trays, and that food is probably not being kept at the correct temperature. So, good question. That was a good question. There were some changes made to date marking requirements that are less restrictive, and I think really good changes. It removed guidelines on how to date mark frozen food, which I thought were a little bit insane. They went through this whole insane process in the food code they do right now. You know, if you put it in, one day you mark that, and you take it out, and you mark that, you put it back in. I mean, so they just removed them altogether. I think our restaurant operators, or hopefully they can figure it out. They now allow, in the 2009 food code, they will allow a 24-hour period with which to use commercially packaged food. The best example that I can give you of this is a bag of cheese. If a restaurant opens up a bag of cheese and they know that they're going to use all of that cheese within 24 hours, they don't have to date mark it. If they're going to use it over the period of 2 days, then they would have to put a date on it, an expiration date. So that's a little less restrictive for them. And then it adds exemption from date marking for a lot of different types of foods that are prepared and packaged at a processing plant, including deli salads, hard cheeses that have low water activity, dried sausages, dried fish, fermented fish, anything like that. They have a whole list in the food code, and I didn't put it here, but there are a lot of exemptions for different types of commercially processed foods. It decreases the hand washing temperature from 110 to 100 degrees. Right now, they have to have a minimum temperature at their hand sinks of 110 degrees, the water coming out, and that would be decreased to 100 degrees. Is something that we check, and a lot of people do get written up for it. This would help them out, I think, a little bit. And it allows floor drains inside of walk-in refrigerators. This is something that we would look at the time of construction. A lot of people want to put floor drains inside their walk-ins because it makes it easier for cleaning, especially if you're mopping in there. And right now, the food code doesn't allow it. And the change in the food code would allow that. It allows for the use of high-velocity blade of non-heated pressurized air for hand drying. You know what I'm talking about? Those newer hand dryers that you see, and the air coming out makes your skin wrinkle, you know, or you stick your hands down inside them. The biggest difference is that right now they're only allowed hot air blowers or paper towels. And this is an example of how science has influenced the change in the food code, where they've looked at the studies and they believe that this is just as effective as the other two. And so they would now allow that under the 2009 food code. This next one has to do with animals. It's a little bit confusing to read, so I'll just explain it. Right now in the current food code, only service animals are allowed inside restaurants. And the ADA has a lot to do with that. We just kind of look at the food portion. But there are exceptions for that, for like service patrol dogs, fish in aquariums, things like that. One of the exceptions is that if it's a group home or a group residence where there's a common dining room, they're allowed to have animals in there. What they've done is they deleted the term group residence, and they've actually added more descriptive language so that now these animals would be able to be in common dining rooms in nursing homes, assisted living facilities, group residences. So I think that was a really good change, and so that's something that's less restrictive. And then the last one I'm going to discuss is that it now allows the use of ozone as an antimicrobial agent on fruits and vegetables. In the not too distant past, you've seen kind of the changes with like swimming pools, you know, where they're using ozone as disinfectant versus chlorine or bromine. Now they're actually starting to use it with food products. And so the 2009 food code is recognizing that new science and allowing it. I actually did have a grocery store in Lake Havasu City recently proposed something like this in their produce department. And so they're picking up on it, the grocery stores especially. And it would probably affect mostly the grocery stores. And in Chapter 8, there were no changes that were less restrictive. So what we've done so far is we've held workshops in Lake Havasu City, Bullhead City, and Kingman. In Lake Havasu City, they have a hospitality group that's already established, so we met with their hospitality group. We had a really good turnout. We worked through the chambers in Bullhead City and in Kingman, and we invited any food establishment that was a member of the Chamber of Commerce to a small workshop. At this point, we were just trying to kind of get a feel for what they thought of making these changes. And the workshops were very successful, and we had a lot of support. After that, we did a mass mailing of the summary sheet that you have in front of you with a letter explaining what we were doing to every single food establishment in Mohave County that would be affected by this. with a survey that they could return to us in a postage paid envelope. So it was really easy for them to fill it out, and we got quite a few back. I think the weakness in that was that we weren't there to explain what these changes actually meant, and a lot of people are afraid of change. So what we're going to do in this next month in February is we want to have 3 public meetings. We want to have 1 in each district and just open it up to anyone that wants to come so that we can fully explain these changes. And we'll go into a little more depth than we did with you tonight so that they're fully aware of everything. The responses that we got back on the surveys between the workshops that we have and the surveys that we sent out in the mail were between, I'm going to say, I think it was like 72 to 75% approval that they would support it. What's interesting is that a lot of the chain restaurants, when you ask if this change will benefit them, they say no. But then if you ask if they'll support it, they say yes. What that means is that they're already doing it, and that's what we found out in the workshops is like, this isn't going to benefit us because we already do all of this. This isn't going to affect us at all, but we'll support you. Yeah, we want to see the food code, updated. So that was really interesting. So after the public meetings, our ultimate goal would be to get, to go to a public hearing in front of the Board of Supervisors, and we would love to have this implemented July 1st. Of the 2014. So that's where my presentation leaves off, and I think Patty's going to come up and say a few things. Unless you guys have any questions, any other questions or comments, suggestions, concerns, heartburn, anything?
It was a very good presentation, and we thank you.
Okay, thank you.
We would like to propose that you try to attend one of the town hall meetings so you can hear and see what the public and the business owners are saying. And then what I would like to propose is that at the next Board of Health meeting, that we would ask you to write a letter of support to our Board of Supervisors to say that you feel like we've followed a good process and that we are ready to you are encouraging them to support this new food code. The other thing I would like to encourage you to do is, if you're interested, nothing is more interesting than to go on a restaurant inspection with one of our inspectors. So if you're interested in doing that, because it'll make a lot more sense if you're able to do that and you have the time, then just call up Rachel. And she'll get you hooked up with one of our inspectors at a time that's convenient for you, and you can go on a restaurant inspection and actually see how this works. It's pretty interesting.
Can we have a badge?
Sure.
Do we get dessert?
I don't know, that's the restaurants. I can try to make you a cookie or something, Terry.
Yeah.
You may not want to eat after the inspection. No, I'm just kidding.
Mr. Chairman, if I could, I guess the one question I had, if we're looking at implementing this, is this, the intent is to make it statewide and nationally?
No, this is just for the county. The state has not revised the state food code because of the moratorium on rulemaking. So they're encouraging the counties to adopt their own county food ordinance so that we can keep up to date with what's going on.
There are several counties in Arizona that have already done this. Yavapai County, Maricopa, Cochise, Coconino County is working on it. Pinal County has made it a priority, so it's happening across the state. But nationwide, I mean, the ultimate goal, I think FDA would like to see it, nationwide. And I know that the food industry wants to see that too. They want to see uniform standards across the entire nation. It's a lot easier. It's a lot easier on them. And they want to see even our procedures. I mean, that's why we have the program standards. This is just one of them. There's 9 standards. So that's what we're working toward.
Quick question. Well, a series of questions. First of all, this is, to the best of our knowledge, best practices,
Yes.
correct?
Yes.
Okay. Regardless of what the populace, I'm assuming we're not, due to the fact that we're not elected officials, what everybody else wants really has nothing to do with whether this is something we actually should be doing for the protection of the populace of the county. Correct?
Yes, I think that is a very, very good way of putting it. I think that the fact that people do want it or that the food industry wants it is just a bonus. I think that these are the best practices. This is reviewed by, like I said, the Conference for Food Protection, which includes all kinds of people from all kinds of walks of life, which is what I think is very unique about this code. They really do get the input from everyone, academia.
So based on the fact that this is best practice, this is what's best for the county, why are we waiting, and as a Board of Health, why are we waiting until after the
The public
town hall
meetings.
meetings and so forth to give our seal of approval? It seems like we're essentially wasting time.
Right.
Oh, well, the FDA recommendations, what year were those?
The ones that we're working under right now,
Yeah.
1999.
No, the ones that we're trying to get in.
2009.
2009, and it's 2014.
Mm-hmm.
So we're 5 years behind already.
Yeah, and, well, actually, yeah, we did debate this just the other day. We would have liked for you to give your approval tonight, and if you want to do that, I'm sure that Patty would be happy to accept that. We thought maybe you would want a chance to go to the public meetings before you did that, just to kind of see what the populace is thinking, but it's,
From
Totally
my
up to you.
understanding, that's not our job. Our job is to do what's right.
Yes, that's great. We would love to have a letter of support from you now. We don't plan to put this on the Board of Supervisors' agenda until April. We have to go through a series, announce a public hearing and stuff. The only reason we didn't ask for the letter tonight is, like Rachel said, is to allow you to attend one of those meetings in case there were any questions or you felt like you needed more information, because this is a lot of detailed information to give you without a lot of prior experience or knowledge about the food code. So we were hesitant in thinking that maybe some of you would want to think about it, do some research of your own, perhaps see what the restaurant, talk to some restaurant owners and see if they had any issues with it. But if you're comfortable with this, we are more than happy to accept a letter from you stating support for this.
See, I'm a little bit ahead because as a member of the Rotary in Bullhead City, I took the class, the food handlers class, so I have a card.
Me too.
Good.
So basically, from my viewpoint, I think I could move that we go ahead and write the letter now, and then if we get a second, then we can have discussion and either vote to do it now or vote to wait.
I think it would be
So-
appropriate to entertain a motion to write the letter now.
So
I
moved.
think it would put us more in a position of leadership, and it might help even the at the town hall, or at the town hall meetings, and they would know where the Board of Health was, where the members were in support of this.
So moved.
I would entertain a motion.
And I will second it, because I think it's a great idea.
I agree, this is 5 years already behind.
Is there a motion then? Yes. And second. Okay. All in favor?
Aye.
Any opposed? No. Motion is passed.
Thank you very much. So
You.
you'll meet with me and we'll get a letter
Yeah, exactly. I think that would be, the best thing to do would be because you'll know the specifics of the wording of the letter that would be most appropriate.
Okay,
Okay?
thank you.
Thank you. The next item is old business, or,
I just wanted to address one item. At the last meeting, information was requested on grandparents raising grandchildren, and I did receive some information day before yesterday, but in looking at it, it's confusing to me and my epidemiologist. So rather than try to pass out some information to you that we're not quite sure what it means yet, we weren't able to get a hold of the state health department and epidemiologist that sent me the information. I'd like to either send that to you by email and we can discuss it next time, or present it at the next meeting. I'm uncomfortable with giving you information. I'm not sure what it was using all kind of statistical terms that I wasn't sure I understood, let alone you guys. So not that you're not statisticians, but it was confusing, so.
with those caveats, I think it would be wiser to present it at the next meeting.
Okay. And that's all in terms of old business that I'm aware of.
Thank you. Is that a call to the public? No? Okay. That being done, we have a motion to adjourn.
Right here.
Second.
All in favor?
Aye.
Adjourn.
Thank you.